good? I don't see any thumbs down, so I'm going to take that as a sign that we could start. Okay? Good morning. I want to thank everyone who's come today, especially media. This is an important one where we're very thankful and delighted to have our press here, because this is an announcement that really requires your help. What Chief Moore, what Dr. Ferrer and I are here to do is to communicate something that's crucial for families. But without your support and without the press helping push out this message, we might not be able to let folks know about these and what happens if we don't take care of making sure we properly dispose of medications that we're no longer using or that are expired. And so that's why we're here today. I want to thank Chief Moore for allowing us to be here at department headquarters. I want to thank him for all the work that he and the men and women of LA City's police department do every day. Certainly one of the tasks is to make sure that people aren't misusing our prescription medications and drugs. I want to thank Dr. Ferrer for the work that she does and all the men and women at the county health system who work hard to make sure that everyone has not just good health, but can maintain a state of well-being that lets them be as good as they can be, to let them thrive. And so we want to thank them for being here. This week, we're going to prepare on Saturday for Take Back Prescription Drugs Day. It is a day that is important. We call it Prescription Drug Take Back Day because this is a day where we encourage everyone who's got some of these drugs that you no longer need. If you know it's an old prescription, it's now no longer good. If it's a prescription you no longer need, please, this Saturday, we have disposal sites where you can anonymously return this medication safely, cleanly, and in a way that helps all of us make sure that we can continue to make sure we're using our medications the right way. So we encourage you to participate October 27th. This is the second day of the year that we're doing Drug Take Back Day, and we encourage everyone to participate, and that's why, again, we're very thrilled to have some of our media here to help us push out that message. We certainly are calling on the public to participate, and it doesn't take a whole lot for you to help us fight back against prescription drug abuse, which has become an epidemic, not just in California, but throughout this country. We are here because too often it's the case that people forget that people die when they misuse these. 63,000 Americans died in 2016 as a result of the use of prescription drug medication which should not have been used illicitly. That and also the use of opioids. It's a major challenge. It's a challenge that those of us in law enforcement know we face every day. And it's a challenge that we know we can't arrest our way out of in this crisis. It has to be a team effort, and that's where all of you who are, I hope, getting this message participate with us. Here at the California Department of Justice with our team at the Attorney General's office, we do what we can. We investigate and we prosecute those who overprescribe prescription drugs, including opioids. Our Bureau of Medi-Cal Fraud and Elder Abuse combats prescription drug fraud against our seniors throughout the state. In April, the California Department of Justice charged Dr. Satwendra Kumar Chopra, a Modesto physician, for inappropriately prescribing opioids to Californians, not just in Modesto, but in every part of California. In addition, California is one of 45 states where the attorneys general are conducting a multi-state investigation into the major companies who do opioids. We're trying to figure out what they did, how they did it, and whether they did it according to the law. Companies like Purdue Pharma, Endo Janssen, Teva Cephalon, Allergan, and others are part of the investigation that's underway on behalf of more than 45 states in this nation. The California Department of Justice also operates and administers the Cures database for California. This is a statewide prescription drug monitoring program that helps cut down on doctor shopping by consumers of medications, and it helps avoid overprescribing practices by certain physicians. The database has been up and running for prescribers, for pharmacists, and for law enforcement. As of October 2nd, however, it's now mandatory for prescribers to use the Cures database to determine whether or not it's appropriate to prescribe certain medication to individuals. These are some of the powerful tools in the toolbox at the California Department of Justice. But just as powerful as these tools are those that we as citizens can use, starting with disposing of medications properly. Leftover, unused, or old medications can be deadly in the wrong hands. Imagine your child swallowing a pill meant for an adult. We also know that flushing these medicines down the toilet can poison our waterways, which ultimately could lead to your faucet. Needles thrown in trash can not only injure innocent individuals, but might kill people as well. That's why National Prescription Drug Take-Back Day, which is coming up this Saturday, October 27th, is so important. We thank all those leaders who are taking steps to make sure we have safe disposal sites available for Americans who wish to participate anonymously in returning their unused medications. At our last prescription drug take-back event in April of this year, we set up 318 total collection sites throughout the state of California. We collected more than 69,000 pounds of drugs in California alone. Throughout the nation, in April, the total was close to 1 million pounds. It's an important tool and a big step in the ongoing fight against prescription drug abuse. And so we need your help. We hope you'll participate. With that, I turn it over to our police chief for City of Los Angeles, Chief Michael Moore. Chief.
Mr. Attorney General, thank you very much, and it is my pleasure. It's an honor to host this today with the Attorney General, great Attorney General from California. Sir, your leadership within criminal justice is appreciated, and we appreciate the organizing of this, knitting this together across the entire state. I'm also happy to stand alongside Dr. Barbara Fiera of the LA County Public Health. This is an occasion for us that I want to draw a parallel to our safe gun buyback program. Many of our Angelenos have weapons, firearms, that each year we encourage them to surrender and turn in so that those weapons don't end up in the wrong hands, whether that be a family member or a young child, or that be someone burglarizing that home and later using that weapon on another individual. And each year we see thousands of weapons that are surrendered. This program is similarly based in that it is going after and targeting in each of our communities dangerous weapons, dangerous chemicals, dangerous substances that are in far too many medicine cabinets. And all of us have medicine cabinets at home. There are collection points for everything from Q-tips to aspirin to all other matters of personal hygiene and care. But they also are a historical snapshot, too oftentimes, of our background where an injury was sustained or some type of ailment and a doctor prescribed everything from painkillers to antibiotics. And we too oftentimes just look over those and continue on with our day, leaving those items behind. And the dangerousness of that is that those are time bombs. Those are ticking time bombs of potential disaster in a home. We have seen this country, we are in the midst of an opioid crisis. And since in the last 10 years, prescription painkillers have quadrupled in number. We have a tremendous prescription of painkillers. And too oftentimes they end up in a medicine cabinet. And what we have seen with the opioid crisis across America is that it's a gateway into illicit drugs. Because young teenagers learn of those substances that are stored away in mom or dad's cabinet and take advantage of trying that pill, of experimenting, of going to a party of pills, and sharing that as an experience of growing up. And too many instances in which a young man or woman dies as a result of that experimentation. That is entirely controllable. That is entirely preventable. And this, I'm proud to be a member with the county health as well as with the Attorney General's office and the Drug Enforcement Administration for these collection bins for these posts. There are 8 of them here in Los Angeles. A shout out of support to the Kaiser Permanente for hosting a number of those locations, as well as the Hollywood Police Station and the Spring Street Park. These locations in the Korea Youth Center and Community Center, each of these locations which are available online, the doctor is going to indicate an additional 20 in LA County, but there's a proliferation of these sites this coming Saturday. And what we ask each Angelino to do is simple. Go to your medicine cabinet, go to wherever you have stored, placed, or located these prescriptions and gather them. Err on the side of caution. If you're not actively taking that prescription today, bring that prescription drug. It's unused, it's expired, it's unnecessary, and it's a danger to your community, it's a danger to your family, and we need you to safely dispose of it. Secondly, and this is a much lesser issue but still a significant one, particularly when it comes to antibiotics, is too oftentimes people use the disposal system called the public toilet, or called their toilet in their bathroom, and they think that it just goes away and disappears. Well, what it actually does is ends up in our waterways and it ends up in our food supply. Because as those drugs they're not filtered out by our sewer treatment plants, they end up in the waterways and end up being consumed by the food chain, which ends up back on our plates, back in our systems. And this is also a health epidemic for us. So at the end of the day, people may say, well, what's it matter? I've just got one of these pills, one of these bottles. So far, you'll hear the numbers. Millions of pounds of these pills is what matters, but each one of them starts with a small container. So as chief, I just ask each of us to go home this week, the next couple of days, look, identify, and bring those boxes, place them in the sites, and be a responsible adult. Thank you. Oh, and at this point, I'd like to now introduce LA County Public Health Director Barbara Fierro.
Thank you.
Thank you.
Thank you so much, Chief, and thank you so much, Attorney General Becerra, for allowing us an opportunity to share our commitment at the Los Angeles Department of Public Health to National Drug Take Back Day. And we join with both the police chief and with the Attorney General in urging all residents to participate in this important event on Saturday. So before we root for our home team, the Dodgers, go into your medicine cabinets, get your prescription drugs that you're not using, and please take them to one of the take-back days. About 1 in 5 individuals who started using illegal drugs in the past year reported that their first drug was a prescription pain medication. And according to the county's chief medical examiner coroner's office, we had about 500 deaths last year in LA County that were attributed to heroin and prescription drugs like oxycodone. Between 2006 and 2013, there was a 30% increase in hospital admissions and a 171% increase in emergency department visits related to opioids. This is a crisis, and it affects all of our families and many of us in our communities. Substance use disorders are complex, chronic health conditions, and many of us know someone or have ourselves struggled with an addiction. It's important for us to realize that anyone can become addicted, and to opioids in particular, and start by using prescription pain medications, such as hydrocodone, oxycodone, codeine, and morphine. And most people who misuse or abuse prescription opioids obtain them from a friend or a relative or a medicine cabinet. That's why National Prescription Drug Take Back Day is so important. And we at the county's health department consider this a critical component of opioid addiction and overdose prevention activities. And we're proudly partnering with SafeMed LA's community education team, the Drug Enforcement Agency, and local law enforcement to host an additional 20 collection sites and resource fairs throughout LA County this Saturday. And this, again, is a place where people can safely and responsibly dispose of expired and or unwanted prescription medications. And I encourage you, take a look in your medicine cabinets this week, get ready for Saturday, see what you don't need any longer, note what can be dangerous if it's taken by someone else, and take time to drop those off on Saturday at a drop-off location. Together, we can make our homes safer and reduce the harmful and possibly deadly effects of opioid use in our communities. Last year in the countywide drug take-back events, we collected over 21,000 pounds of prescription drug waste. And this, again, was waste that neither went into somebody's body who was not prescribed that medication, nor went into our water, nor went into our landfills. You can visit our public health website to find the drop-off locations, and through your participation, we're hoping that we increase the amount of medications that we collect this year. And I want to also take this as an opportunity to make sure that all of our residents are aware that treatment is available if you become addicted to alcohol or drugs. And this includes prescription pain medications and other opioids. Substance use disorders affect about 20 million people in the United States, and less than 5% of people seek treatment. So it's so important that we destigmatize this chronic illness and that we talk to each other about substance use and addiction. We need to make sure that people know there are a lot of options for treatment that are available. So if you know someone that you love or you yourself need some help, we have a substance use hotline 24 hours a day, 7 days a week. It's 844-804-7500, and I urge you to call that number to get treatment. We hope that you'll look at your medications in your home. If any are unneeded or expired, please join us all in making sure that those are taken to a drop-off location this Saturday.